COVID-19 cases are rising nationwide. Now, most cases are mild, but it still has medical workers on alert.
Just yesterday, former White House coronavirus response coordinator Dr. Deborah Birx warned Americans to expect a surge this summer here in the southern United States. Joining us live is Dr. Mark Casanova. He is a physician in Dallas and a member of the Texas Medical Association's COVID-19 task force.
Thank you so much for being with us, Doctor. We hear that the BA.2 variant is the variant affecting the most people today. How is this variant different than other variants we've seen like Omicron or even Delta?
Well, BA.2 is in essence an Omicron variant or subvariant, so it's an Omicron cousin. What sets it apart from Omicron is that it's more contagious, and that has been the pattern. So BA.2 is more contagious than Omicron, which is more contagious than Delta, which is more contagious than Alpha, and more contagious than the original strain. So you've seen the ability for this virus to transmit go on an upward scale. Now, the positive news, the silver lining, is that the infections that it renders are not as severe as some of the earlier variants, specifically Delta. So folks aren't necessarily getting sicker, but there's a potential for more folks to be infected. And out of those who do become significantly ill and need hospitalization.
Some of our viewers at home might be saying, you know, I've done everything I can do. I've been vaccinated. I've been boosted. Dr. Casanova, what is the takeaway for people like that?
Well, the takeaway is number one, thank you. Right? Thank you on behalf of medicine, and thank you on behalf of your fellow human beings, because you're part of the solution to this. You are, in fact, helping yourselves. We know it's disconcerting to think, I've done all that I was supposed to do. I got my boosters, and here I hear on the news that there's still a threat that I may come down with this BA.2 infection. That's true. But what we do know is that you are still highly protected and benefit from that in terms of serious illness and hospitalization. And the more people that are vaccinated, the slower the spread of this virus. This virus only mutates as it reproduces and spreads, and it needs us humans to accomplish that. So the more that we can tap the brakes on it, slow it, the better we can come out of this.
And Doctor, how are health officials accounting for the so-called ghost cases that are out there? That's where people will test positive using an at-home test and never report it to the local health department or the state. How do you handle that?
Well, the reality is we've had ghost cases all along. In the early days, if you remember, we were mentioning the fact that we knew there were a certain number of individuals that were walking around asymptomatic. Well, one might argue that's similar to a ghost case. What we don't have a clear idea on is just what percentage that is. Now, having said that, we still have good data, raw data, that shows us cases in general are increasing. So one can extrapolate and make a safe bet that those ghost cases are increasing as well. I don't think it necessarily blinds us or binds us in any way. It's just an awareness that, hey, listen, we do have at-home testing. That's a positive. So if you have symptoms, test, and then isolate if you're positive.
Some really good information. Dr. Mark Casanova live from Dallas. Thanks for being with us here on KXAN.
Thank you. Be safe.